Tandala with Dr. Ayang. I have three experts here who will tell us a little bit more about this new industry in education and in therapy, health therapy, psychology therapy, called art therapy. So what is it? What is it about? And why is it gaining momentum? Let's talk about it. So our first expert is Nasamu over here, who will give us a little bit more of his background. Muambre here, and Miss Alice here as well. So let's start with you, brother, and give us a little bit of your background and how this connects to the topic at hand today.
So my name is Nsamu Monga, a therapist who currently lives and resides in Johannesburg, where I'm licensed and I practice. I'm licensed with the Health Professions Council as an arts therapist. What that means is that I'm licensed. I'm licensed to practice within the health professions spaces and the healthcare spaces to provide the modalities and the modes of the arts as a means of meeting people's needs, more than just the artistic needs.
Yes.
So what that means then is that arts therapies are a growing form of therapy globally, not just in some spaces, but around the world. But we're going to speak a little more, maybe in a while, about what that actually means and what that looks like and why the arts therapies. But in a nutshell, I am really interested in the intersection between the arts and indigenous practices. I always look at indigenous practices as comprehensive and integrated arts in that sense, and to look at that as the resource that we can use to promote health and well-being. In this particular case, it's not just psychological health and well-being. It also means physical, social, collective, and relational well-being.
Yeah, we'll definitely dive into that a little bit later. So it's a lost form of art culturally and so forth that is now being utilized in a more psychological and academic way. Yeah, we'll dive into that. And one, give us your background in this industry.
Okay, thank you, Doc. My name is Mwamba Chisashi. I have a lot of experience in adolescent health program, and currently I'm also working with young people in Matero on a mental health project as well. When we look at the arts, I think when we talk about art therapy specifically, for me, and looking at where we're coming from as a nation, mental health is something that's still new, and there's a lot of stigma attached to it. So art therapy seems to be the way forward because not everyone is able to express themselves verbally. Some people are better off expressing themselves in various ways. And this is why I think young people would really jump onto the bandwagon to take up the art therapy as one of the ways to improve their well-being.
Yes, by releasing and expressing. Now, Alice, I've seen, like Nasamu, you actually do practical work in this area. Can you tell us a little bit about your background and what drew you even further into utilizing this practice to help people?
Okay. My name is Alice Muyambo. I'm a visual artist, an author, and I also advocate for mental health. And one of the things that I find very interesting is I'm a self-taught visual artist. And when I decided, or when I delved into more practice of mental health, is I had a personal experience of high levels of anxiety. And this expressed itself more during COVID. And at that time, I was away from home and not knowing what is the next step. And where I was, it was more intense than it was back here. And during that time, I started to read more about trying to understand myself from the perspective of being very anxious. Why am I feeling this anxiety? I've not experienced this before. And I started to read more. But what I didn't know is subconsciously I would go to my art. So every time I felt very anxious, I would go and grab something, and I would spend so much time without the intention or the expectation of creating something that is already anticipated.
Yes.
But I didn't realize that. So it took me a while. Then I realized that no, actually, every time I'm very stressed and every time I feel a sense of anxiety, I rush to my art subconsciously. So then I started to see what is the intersection between these two emotions.
Yeah.
There's the expressiveness in the arts, and also now the emotional part of how I'm feeling that, and it's a moment of being anxious.
Yeah.
So I started to read more, and then I realized that a lot of people don't know that you can actually use art as a form of therapy, and sometimes you can also use it to just distress. It's not so much that it has to always be therapeutic, but it's something that can help you organize your thoughts, and also in a moment of where you're feeling maybe a sense of panic, rather than doing something that would affect you, you would rather enforce something that will better your
Yes.
well-being. So
Yeah.
those are the areas that I've really focused on. And coming from the industry of being an artist, it's something that I've integrated to now manage the mental health and advocating for it, and then
Yeah.
also bringing the creative and the expressive side of it.
Yes.
Yeah.
It's things like coloring, listening to music,
Yes.
all these. There's so it's so wide and so diversified. The arts in itself. So let me ask you this first before we dive into what happened with the culture and all the ways people in Africa specifically, and this may be something that you're working on, Nasama, that you can answer. What shifted? Where people weren't utilizing anymore. And then now we see, not just here in Zambia, but other African countries where suicide levels are through the roof. People are letting go of hope. They're unable to see beyond the now. So, what were some creative art coping mechanisms of our African past that we forgot? And how are you specifically connecting through art therapy, bringing that or bridging that to something that's understandable now? Does that make sense?
It- yeah, I think it does. I want to what I'm hearing is that we are speaking about a particular kind of experience of mental health in this particular case, right? So it does help us to step a little bit back and look at what do we mean by mental health, and then look at the historicity of that, because part of what is happening here is that if we look at the history, we're going to discover that something has changed and within the social fabric of our organization as a people.
Yes.
The way we organize and the way we're organizing ourselves and the things around which we are organizing our lives has changed.
Yes.
And so for me as a student of health and specifically of psychological health, I'm always aware of the temptation to want to separate an individual experience
Yes.
from social and collective evolution
Yes.
that may have led us to where we are. So we need to understand that first,
Yes.
and the departures from
Yes.
from systems that supported our well-being to
Yes.
where we are were part of what we are experiencing. And to a large extent is the separation and this idea that we are just individuals within this particular indifferent world.
Yes.
So once we understand that, then we're going to realize that a lot of the distress and the stress, the stress that a lot of people, especially in urban areas, are experiencing are as a result of this particular isolation that comes from urbanism,
Yes.
from the indifference
Yes.
of urban culture. Right.
If I may interject, I'm getting a visual as you speak, whereas in the past, there was circular connections. There were many pieces as one unit. And now the world kind of had moved into more of a linear movement.
Yes.
We're all in a linear path.
Mm.
So that support system, that understanding, that connection is kind of distant. Would you think Would you say that that kind of contributed to a lot of this mental
I mean,
illness?
think about it. If you're driving on the streets of Lusaka, you are a solo driver among many other people,
Yeah.
right? So there's something isolating about that. Whereas if you're living in another setting, you're walking and there are many other people walking with you.
Even on the public bus.
Even on a public bus.
Yes.
Right? People are talking, people are relating with you, people are connecting with you.
Yeah.
Right? So, and this is, we need to have a broad understanding and broad conversation around all of that and how that is impacting
Yes.
our lives together.
Yes.
And that's why I like to expand the discussion around mental health to be more about psychological well-being,
Okay.
which is not just about what happens between somebody's ears,
Yes.
right, and what happens in somebody's brain,
Yeah.
but to look at all the ecological and socio-ecological issues that may be impacting on the quality of life, on the meaning of life for a particular individual. And that ecology is now what we're now beginning to connect with movement, with dance, with song, with play, with all of these art forms.
Yeah.
In the indigenous setting, they're not art forms. They are ways of expressing ourselves. They are ways of connecting
Practical form,
with
yes.
ourselves and others. They are
Yeah.
ways of connecting with the land and the ways that we connect with our ancestors and the people that form our life force and our life circle.
Yes, very good. You mentioned that you work with the youth in the compounds and so forth. What in this art therapy sessions type that you have is making a difference? Like, what are they mostly responding to? Because it's mainly, just to add, I know some of the hardships psychologically with people from compounds and townships, and as they say in South Africa, is economic pressures. So what has been your experience providing this service for the youth?
So from my experience, I think just to add on to what he's saying, I think it still comes back to having a safety net. If you look at where we're coming from, we used a lot of storytelling as Africans, a lot of drama, a lot of songs, a lot of dancing. And I think that's something the young people respond to. A lot of dancing, a lot of singing. So we encourage them to write. Write how you feel and compose a song out of it. And that's something I think a lot of young people respond to because most Africans, I think most Zambians are music lovers, and music is a part of our being as human beings. So it's a lot of singing, a lot of dancing for us. I think that's what they're responding to.
So they're showing a lot of release and expression of that release through music.
Yes, and it's helping them build a lot of resilience as well. So through that whole process, you notice that there's some resilience building because then they learn healthy coping mechanism. Unlike going to abuse substances, then they notice I can dance it out and I'll feel better.
And that connection with one another as well creates a space of I'm not alone. It's like a sense of community. Now, Alice, your background is also psychology, right? Or counseling.
More of economics.
Economics.
It's, I think by personality, I am those people that has always been just drawn to understanding the psychological impacts, the mind, and all these very like self-preservation. So there are certain things that growing up I would really incorporate in myself, like positive speaking. So I've always been very big about my positive speaking,
like affirmation.
Yes. So what does that do for you? What does that do for the next person?
So what I heard from your first statement in this is that you use these practicality exercises on yourself, which help, and you thought, let me teach other people how to do this so they can get relief as well. Now, I read some of your background. You actually have somewhat of a global presence. You move around to different conferences. You've been active in promoting this industry of creative arts as a therapy, mental therapy, health therapy. Do you think it's just a fad now, or do you think it's something that's starting to stick?
Well, it's been on a personal level, it's been very hard to actually convince, and I realized trying to convince people is not the way to go about it. Is to actually make them understand and not convince them. And I feel like those two, because if I'm trying to convince, is I'm coming with, look, the way out is this.
Yeah.
This is what you should do. And I realized that people have different backgrounds, people have different life experiences. I will never know how it feels based on another person's story. I can empathize, I can sympathize, but I'll never understand the gravity of what someone is going through. So what I do is I will give you something that is practical to try, something that I have tried, so that it's not, I'm not speaking from without experience. And also to speak is, I believe that the world is so large to only follow certain rules. Not everyone is going to have a chance to sit in a class and learn about psychology. Not everyone is going to sit somewhere or have the time to go through the process of being a therapist. But there are so many things that we have moved on from as human beings that are beneficial for us to go through life, that we have taken away, and we've replaced a certain level of education and attached those things to the educated. So when I speak about art therapy, someone is assuming it must be someone who must understand what it is, who can take part in that activity. Or it must be someone who's artistic to take part in that activity. So all these things come from, I don't think I am part of that. You know, people see when you put labels to something. If I go to someone and say I'm a therapist, they will already be apprehensive and they'll have this kind of shield. But when I say I'm a visual artist, they, oh, okay. And then through that, I now channel it to, do you know that speaking positively to yourself is something that can help even just change how you're feeling in one day? Have you ever, what is the best thing that you've said to yourself today? Now that is something that anyone can understand.
So Alice, you do workshops here in Lusaka. Tell us about the location. If people out there want to give this a try or see a little bit more tangibly, what is this about? Where can they come and when?
Okay, so there's this thing that I've introduced now open to the public, and it's art therapy. I want people to understand that we're coming to create from our emotions and also just be very expressive and release some of the tension that we've experienced throughout the whole month. So this is every last Sunday of the month, and it's going to be 12 to 14 hours at Garden City Mall. There's Chongwe Community Art Gallery there. So I want people to be open-minded. Just come, be free, step into the space and experience. And the way we
come barefoot,
come very comfortable clothing, and we've set it up in the way that it's beyond just art. When you enter that space, you know that I'm beginning to step into my journey of healing. And no matter how small the step might be, the most important thing is that you've taken that step. So there shouldn't be this stigma that when you come for art therapy, there's something wrong with you. No, there's nothing wrong with you. But what we just want to show you is there are positive interventions. We know what the causes of mental illnesses are. We know the causes, but how about we talk about the interventions? So that is where we're coming in with the art therapy sessions. Let's start to heal ourselves. Let's start to heal our communities. One step at a time.
Well, I'm going to show up for one of those sessions.
It would be lovely to have
and
you
experience
there.
that. Now, Nasamo, I did attend partially one that you were doing here at Open Window University last year. And it was like an intro to art therapy. And I found it to be so freeing. I mean, I always knew I was a free spirit, but I was like, everyone's looking at me like, why are you acting like a kid? Because inside I am. But it's something that allows you to just be free in your thoughts, in your expression of drawing, in your interaction with people. Now, is it you that's working on your PhD or doctorate? In this area. And you're also trying to introduce this form of therapy, psychology therapy through the arts at the university level. Can you tell us a little bit about that? And is it a difficult journey, or do you think it's something, like I asked her, something that would stick?
They're not a fad, right? There's a reason. There's a reason they've been around for nearly 100 years around the world, right? And longer in certain places, and they've had different iterations in different parts. You know, South Africa itself has got hundreds of licensed therapists, right? And ranging from movement and dance therapies, art therapy, drama therapy, music therapy, right? So there are all these other forms of art therapy. So it's been going around. The University of Pretoria has been training music therapists for more than 25 years. So, and the University of Johannesburg has got a master's degree training for art therapy.
Wow.
The university, the Witwatersrand University, has got a movement and dance therapy program at a master's level. They've got a drama therapy program that has been going on for years,
Yes.
for almost 15 years now. So the trainings are around. And so, and I am in the process of finalizing my doctoral study.
Yes.
Within that particular field where I'm exploring this in Zambia. I'm working with patients, with people with cancer at the university teaching hospitals here, at the Cancer Diseases Hospital. So I'm in the process of presenting all these experiences to the patients. So that's where I am. And also we are in the process of starting a certification course at Open Window University. So that's looking like it's going to be happening in 2026. At the moment, we're working with a curriculum, and hopefully by the beginning of the academic year of 2026, we're going to have people training, in not necessarily for the beginning in art therapies, but they'll be able to use the arts in different spaces. These will be professionals like myself, who was already a practicing psychologist. So I can then, as a psychologist, come into training how to use the arts in different modalities within that particular frame. We're going to have teachers coming to learn how to use the arts in education, not as a subject, but to use the arts in education to facilitate learning. How we're going to work with community leaders to use the arts for community mobilization, for leadership. We're going to be working with leaders to use the arts to facilitate leadership. So that's the postgraduate diploma that we're working on at the moment. We're going to be working with other health practitioners to use the arts to facilitate health communication, to facilitate health for their patients. So that's the lens with which that we're working towards bringing this training at Open Window University next year.
Well, to answer the question of will this stick, I see it as something that's sticking. And it starts with people like you all kind of bringing it to the forefront. As diversified as creative arts is, it sounds like to me all the different areas that it can help, from just stresses in the work field to motivating children in the compounds to helping people that are sick with cancer to not lose hope and still live dignified with whatever they have left, or it may heal them too, because healing comes from inside here first, right? And then the body follows. So it's quite fascinating to me, really. And we all need, from just the basic people to those that are in desperate need psychologically, we all need a little bit of therapy intervention, either through dance or singing or art, right? So it's a quite fascinating topic. Would you like to add anything else in terms of the students and the youth that you assist? What results have you seen with them? Have any of them, in your experience, came up to you and said anything about what they experienced?
Okay, thank you. For me, I can't say I have seen results per se, but whenever we have our sessions, at least we do more of like a baseline check-in. So how are you feeling today? And then when we're done, how are you feeling now that we're done? How does it feel like? Do you still feel, how are your emotions feeling? Do you still feel stressed? Do you still feel sad? Do you feel hopeful? Because at the end of the day, all you want for a young person is for them to be hopeful. I think when someone loses hope in life, then that's the beginning of a lot of problems for us as a nation. But then what we're also trying to teach is resilience, right? And with resilience comes with someone being hopeful.
Yes.
Like just being hopeful about the future, being hopeful to say they can overcome whatever challenges that have come their way.
Yeah.
So for me, I can't say it's results, but then we always just do the pre and the post check-in, and we use different emotions like, okay, describe how you're feeling now, how's it going? Because it's always a different experience. So sometimes someone will want to talk about it. Sometimes there's no words to how someone feels after a session.
Yes.
And even before a session, there's no words. You ask someone,
Yeah.
how are you feeling today? They don't even know what
Yeah.
word can describe how they're feeling. But then maybe after a session, they'll be like, okay, now I think I can now name an emotion. Maybe I feel excited.
Yeah. Because they
I
become
feel,
hardened.
yes.
They
So
bottle things up inside.
yeah, so
Yeah.
it's always a point for us to just ensure that our people walk out hopeful, to
Yeah.
say whatever is happening, it will get better. The sun will shine again one
Yeah.
day.
Yes.
Yeah.
So one last question, because this is an area we didn't touch on, but it's a global phenomenon. And to me, it sounds like this type of therapy would help tremendously. All the autistic adults that are walking around and children, I think now statistically, many countries, 1 in every 30 children born falls on the autism spectrum. So there are articles out there that state your speech therapy and this and early intervention and all these things help, but there are a lot of it because autism just really came to be known as autism like in the 90s. Before, it was either you were a nerd and a genius, or the term that they used then was retarded. So if you fell on the lower part, you weren't, your capacity wasn't well. But people who are autistic, just their brain is wired differently. They're actually geniuses.
Yeah.
But managing their emotions, managing how they navigate through life is what's challenging for them. And I feel like what you all are doing and learning and practicing, I think is going to change a lot with the autistic world. You want to touch on that a little bit, and then we'll close up.
It's a very difficult question to answer in a short term, because first of all, autism is a very complex psychological phenomenon on its own, and as you rightly put it, it's on a spectrum. So there's still very little known about the experiences of autism per se, right? So there are lower functioning people on the autism spectrum, and then there are higher functioning people on the autism spectrum, and all the people in between. And each of those has a particular experience of what it means to live with autism, right? So a lower functioning person on the autism spectrum will definitely have a very different experience from a higher functioning autism person who can walk into a room and keep a conversation going. Having said that, the arts, even if it were within the realm of working with people on the autism spectrum, they provide a wonderful way of engaging with a phenomenological experience, the lived experience of an individual, and to be able to take that experience and allow that to kind of find some expression, whether it's through movement, whether it's through dance, whether it's through creating something, whether it's digital media, whatever form of artistic expression that might be, the person can have that. But one can say that about anybody else, right? So removing that label of the diagnosis to give a person a way of expressing what it is like for them to live with that particular experience.
Yes. Because it's like snowflakes. It's individualized. That's why they call it a spectrum. Would you like to say anything?
Yeah, I would like to add on to what he's just shared. And this is also a personal view of how, as human beings, we have this notion of putting people in boxes. I've been asked before by people to say, is this something for the art therapy? Is it for women only? Is it for boys? Is it for anyone? And I'm thinking, I'm just saying art therapy. It's not labeling anyone. Anyone who feels they want to learn about art therapy and come to a session that I'm taking them through is welcome. I hear people asking all these, where you label people, this person, and categorizing people, and I feel those are also some of the things that have hindered the reception of therapy itself, because it's always labeled. So immediately they hear or see the term therapy, it's associated with a picture they have been associated with, or they have seen within their community who they feel that person requires therapy. I don't. but everything can affect different people in different ways. Even just stress. Even before you are diagnosed with a mental illness, mental health is just how are you taking care of your mind? Like how are you servicing your mind even?
Yeah.
Like your mental capacity, how are you handling that? It's the same thing when you go on a diet.
Yeah.
You say, I want to put on weight or I want to lose weight.
Yeah.
You're going to follow certain rules of certain things that you will eat or not eat. So why does it become different when we say mental health? Why does it now come up as an illness, or it's something that a taboo that we can't talk about?
Yeah.
Why is it any different from any other forms of health?
Yeah.
Because so that I feel the categorizing of a lot of things is what has also led to the society viewing things of therapy in a more kind of like something that I don't want to be associated with.
Yeah, so there's some cultural restrictions
Yeah.
as well. But the more of these conversations that take place, the more of these workshops that take place, these studies that you all are doing, I think the more understanding that you bring to the table. You know, I think at some point it will become something that is very familiar with people. And then at some point they will also realize this is very helpful.
Yeah,
You
that's
know?
true.
So anything you like to close off with regarding this this form of therapy, art therapy for mental health, for physical health? Anything you'd like to add? You have a workshop coming up. Would you like to talk about that? Or one that's been
Yeah,
planned?
we have a workshop that's coming up. It's a certification workshop. It's a 10-day workshop that will be running at Open Window University in July. So that workshop is aimed for professionals, practitioners, like I said already.
Alice will be there.
Yeah.
She'll be there.
It's meant for psychologists, counselors, social workers, community leaders, organizational leaders, educators, people who are already practicing in their space and in their field, who want to come in and appreciate the use, because there are ways in which we use the arts as well. We need to also accept that, right? There are particular ways, there are modalities. There's a thinking to it. There's a theory to it, and for people that train in these particular spaces, spend a lot of time trying to understand the relationships between all of those. And so those that are already practicing, whether it's as psychiatrists, I've got psychiatric colleagues who are benefiting from the use of the arts in their work already. Right? So they're already seeing benefits, So there are multiple ways, whether it's somebody's an occupational therapist, right? So there are ways in which we can work with the arts that would then enhance our work, and the evidence is there, right? It's quite a pity that in Zambia we haven't got there yet, but we are getting there. I mean, we have to get the training going. We have to get training right. Training outside of the country is very expensive. So if we can get the training in the country, it would do a lot of good to a lot of people. Right. So rather than relying on a few people that can afford to go and train elsewhere, we can get the training here. And people can train locally and then work in communities.
I think what will help is giving you guys more exposure, because I feel like even though we're ending this conversation, I feel like we only touched the surface of it. So one of your workshops and one of your workshops, and while you're with the youth, perhaps we can get the media involved and see what takes place, how it's helping people and so forth. So it becomes not only familiar, but people see the value of it as well. So these types of sessions and educational lessons are taught outside, but not here in Zambia yet. So that's a huge initiative. Maybe perhaps this workshop you're going to do in July is going to open doors for it to be an educational subject here at Open Window University, which is a creative arts university.
Absolutely.
So we'll take it from there. I say kudos to all three of you. the work you're doing is selfless. Whenever you're doing work that you studied in service for other people, it's always very admirable. And I'm pretty sure it's rewarding for the three of you in some way as well. Yeah. So thank you so much for being a part of this. We'll sit down again
Thank you.
Thank you.
and discuss.
Yeah.
Thank you,
That would be great.
Alice.
Thank you for having me.
Thank you so
You're
much.
very welcome.